What does sleep have to do with diabetes?
So sleep is being connecting to us at a greater length with almost all the bad or the adverse outcomes, which is like those who are having diabetes and having sleep apnea. There is a condition called
Yes.
sleep apnea. It is nothing but a sleep disorder, which is probably remain unexplored or undetected, and that is where I think we need to pitch in, because this is the condition which can not only invite hypertension or high blood pressure.
Is it cyclical? Like does
It is cyclical. It is definitely, it's a triad.
Hmm.
It is known as Pickwick syndrome.
Okay.
So obesity, cardiomegaly means enlargement of the heart, and high blood pressure. And it will lead to abnormal heart rhythm. It will lead to refractory blood pressure. That means your blood pressure is not getting under control even if you take 7-8 medicines. So that is where I think you need to pitch in, and you need to find out whether the patient is having history of snoring, whether there is a daytime sleepiness, whether the lack of concentration in their day-to-day routine life. In the early morning hours, they are having headache. They are having lot of early morning, waken up issues. In the middle of the night, they are getting up and developing this problem. Then you need to identify with the help of plethysmography.
Is this easily accessible?
Absolutely easily.
Does every hospital have one of these?
Everyone, and now it is probably done portable. I mean, you can do it at home also.
Okay.
So it's not that you need to get admitted to do this test. It can be done at home as well.
What about night shift workers, for instance? Because then your schedule goes for a toss.
Yeah, but
So-
at the same time, they should have a good sleep during daytime, because their cycle is now completely different. So body is having a circadian rhythm. God has given that circadian rhythm. Now it has been completely changed. So definitely it is going to have certain problems, but at the same time, night shift workers, they have to be very sure. They have to check their regular, that pulse, blood pressure, and sugar and cholesterol. These are the four things. They should check it very regularly.